everyone, welcome back to the Parker Investigator channel. In today's video, I will be going over the Hantavirus, specifically the Andes strand. Earlier this month, there was a cruise ship that had an outbreak of the virus, and it ended up killing 3 people. There was a lot of talk about this Andes virus becoming the next COVID. In today's report, I will be going over what the Andes virus is, how you can prevent yourself from getting it if it is another COVID, also what measures are being taken for the passengers on the cruise ship that are still alive, and if there are any vaccines for the Andes virus. A description of the situation is found on the WHO website. All my sources will be in the description. On 2nd May 2026, WHO received notification from the National International Health Regulations focal point of the United Kingdom of Great Britain and Northern Ireland, hereafter referred to as the United Kingdom, regarding a cluster of severe acute respiratory illness, including 2 deaths and 1 critically ill passenger aboard a Dutch-flagged cruise ship. On 2nd May 2026, laboratory testing conducted in South Africa confirmed hantavirus infection in 1 patient who was critically ill and in intensive care. On 3rd May, 1 additional death was reported. A further 3 suspected cases remain on board. As of 4th of May, a total of 7, 2 confirmed and 5 suspected cases, including 3 deaths, have been reported. The vessel departed Ushuaia, Argentina on 1st April 2026 and followed an itinerary across the South Atlantic with multiple stops in remote and ecologically diverse regions, including mainland Antarctica, South Georgia, Nightingale Island, Tristan da Cunha, St. Helena, and Ascension Island. The extent of passenger contact with local wildlife during the voyage or prior to onboarding in Ushuaia remains undetermined. The vessel carries a total of 147 individuals, including 88 passengers and 59 crew members. Onboarding passengers and crew represent 23 nationalities. As of 4th May 2026, the vessel is moored off the coast of Cabo Verde. Summary of cases. Case 1. An adult male developed symptoms of fever, headache, and mild diarrhea on 6th April 2026 while on board the ship. By the 11th of April, the case developed respiratory distress and died on board on the same day. No microbiological tests were performed. The body of the passenger was removed from the vessel to St. Helena, a British overseas territory, on the 24th of April. Case 2. An adult female who was a close contact of Case 1 went ashore at St. Helena on 24th of April 2026 with gastrointestinal symptoms. She subsequently deteriorated during a flight to Johannesburg, South Africa on 25th of April. She later died upon arrival at the emergency department on 26th of April. On 4th of May, the case was subsequently confirmed by PCR with hantavirus infection. Contact tracing for passengers on the flight has been initiated. Case 1 and 2 had traveled in South America, including Argentina, before they boarded the cruise ship on 1st of April 2026. Case 3. An adult male presented to the ship's doctor on 24th of April 2026 with febrile illness, shortness of breath, and signs of pneumonia. On 26th of April, his condition worsened. He was medically evacuated from Ascension to South Africa on 27th of April, where he is currently hospitalized in an intensive care unit. Laboratory testing on an extensive respiratory pathogen panel was negative. However, polymerase chain reaction testing confirmed hantavirus infection on 2nd of May 2026. Serology, sequencing, and metagenomics are ongoing. Case 4. An adult female with presentation of pneumonia died on 2nd of May 2026. The onset of symptoms was on 28th of April with fever and a general feeling of being unwell. 3 suspected cases have reported high fever and/or gastrointestinal symptoms and remain on board. Medical teams in Cabo Verde are evaluating the patients and collecting additional specimens for testing.
Well, the cruise ship set off at the very beginning of April on its voyage from Argentina and made its way to the archipelago nation of Cape Verde, just off the coast of West Africa, and it was anchored there for 3 days. But it's now making its way further north to the Canary Islands, and we're expecting it to arrive in Tenerife at the weekend. And Guy Hedgeko is on the island.
Here in Tenerife, people are awaiting the arrival of the Honduras cruise ship at the weekend. And there is a certain amount of unease among the local population. There are many people here who are concerned because they believe that the arrival of the boat with those nearly 150 passengers on board could pose a health risk to them, and they're concerned about the safety measures that are in place when the boat is received, or not in place when the boat arrives. Now, the central government has insisted that there will be very tight safety measures in place to make sure that the virus does not spread to the local population. It has said, for example, that the boat is not going to dock in the port, but rather it's going to anchor out to sea, and then the passengers will be brought by smaller boats to the island from where they'll be repatriated.
Well, we're joined by our health editor, Hugh Pym.
Now, there is quite a big international effort going on now, because some of the passengers left the cruise ship in the island of St Helena, about 30 of them, and then went their separate ways. So there's an attempt being made to find other passengers who are sitting very close to them on the flight and so on. And we know 2 Britons are self-isolating back in the UK because they came home early. They didn't even know there'd been a virus, but they reported themselves, and just out of a cautious principle, they are self-isolating. But it's being emphasised that the human spread requires prolonged contact, and therefore, for example, sharing a cabin or that sort of thing. So as somebody put it to me yesterday, it's got to be someone sitting next to you on a flight, not the whole aeroplane.
Hugh, thank you very much.
Concerning the passengers' whereabouts, a total of 94 passengers of 19 nationalities were evacuated from the ship on May 10th, the first day of evacuations. Spanish Health Minister Mona Garcia said at a news conference. A May 10th World Health Organization post listed 11 reported cases, including 3 deaths. 9 of the 11 cases were described as confirmed and 2 as possible. Passengers were taken from the ship to shore in small boats and transported to Tenerife Airport in military buses without coming into contact with the public, according to Reuters. What is the Andes virus? On WHO's website, they explain what the Andes virus is. Key facts of hantavirus. Hantaviruses are a group of viruses carried by rodents that can cause severe disease in humans. People usually get infected through contact with infected rodents or their urine, droppings, or saliva. Infection with hantaviruses can cause a range of illnesses, including severe disease and death. In the Americas, hantaviruses can cause hantavirus cardiopulmonary syndrome, a severe respiratory illness, with a case fatality rate up to 50%. Andes virus, found in South America, is a currently known hantavirus for which limited human-to-human transmission among contacts has been documented. In Europe and Asia, hantaviruses can cause hemorrhagic fever with renal syndrome. Overview of hantavirus. Hantaviruses are zoonotic viruses that naturally infect rodents and are occasionally transmitted to humans. Infection in people can result in severe illness and often death, although the diseases vary by type of virus and geographical location. In the Americas, infection has been known to lead to hantavirus cardiopulmonary syndrome, a rapidly progressive condition affecting the lungs and heart, while in Europe and Asia, hantaviruses have been known to cause hemorrhagic fever with renal syndrome, which primarily affects the kidneys and blood vessels. While there is no specific treatment that cures hantavirus diseases, early supportive medical care is key to improve survival and focuses on close clinical monitoring and management of respiratory, cardiac, and kidney complications. Prevention depends largely on reducing contacts between people and infected rodents. Viral family and classification. Hantaviruses belong to the family family Hantaviridae within the order Hantavirals. Each hantavirus is typically associated with a specific rodent reservoir species, in which the virus causes long-term infection without apparent illness. Although many hantavirus species have been identified worldwide, only a limited number are known to cause human disease. Hantaviruses present in North, Central, and South America are known to cause HCPS. The Andes virus is part of this family and is known to cause limited human-to-human transmission among close and prolonged contacts, primarily in Argentina and Chile. Hantaviruses found in Europe and Asia are known to cause hemorrhagic fever with HFRS. Human-to-human transmission has not been documented in this part of the world. Burden of disease. Hantavirus infections are relatively uncommon globally, but are associated with a case fatality rate of less than 1 to 15% in Asia and Europe, and up to 50% in the Americas. Worldwide, it is estimated that from 10,000 to over 100,000 infections occur each year, with the largest burden in Asia and Europe. In East Asia, particularly China and the Republic of Korea, HFRS continues to account for many thousands of cases annually, although incidence has declined in recent decades. In Europe, several thousand cases are reported each year, mainly from northern and central regions where Pumila virus circulates. In the Americas, HCPS is much rarer, with hundreds of cases reported each year across the continent. The United States of America has reported fewer than 1,000 cases, while South American countries such as Argentina, Brazil, Chile, and Paraguay report small numbers of cases annually. Despite the lower incidence, HCPS has a high case fatality rate, commonly between 20% and 40%, making it a disease of major public health concern. Transmission. Transmission of hantaviruses to humans occurs from contact with contaminated urine, droppings, or saliva of infected rodents. Infection may also occur, although less commonly, through rodent bites. Activities that involve contact with rodents, such as cleaning enclosed or poorly ventilated spaces, farming, forestry work, and sleeping in rodent-infested dwellings, increase exposure risk. To date, human-to-human transmission has been documented only for Andes virus in the Americas and remains uncommon. When it occurs, transmission between people has been associated with close and prolonged contact, particularly among household members or intimate partners, and appears most likely during the early phases of illness, when the virus is more transmissible. Symptoms and clinical presentation. In humans, symptoms usually begin between 1 and 8 weeks after exposure, depending on the type of virus, and typically include fever, headache, muscle aches, and gastrointestinal symptoms such as abdominal pain, nausea, or vomiting. In HCPS, the disease may progress rapidly to cough, shortness of breath, accumulation of fluid in the lungs, and shock. In HFRS, the later stages may include low blood pressure, bleeding disorders, and kidney failure. Diagnosis. Early diagnosis of hantavirus infection can be challenging because early symptoms are commonly with other febrile or respiratory illnesses, such as influenza, COVID-19, viral pneumonia, leptospirosis. A careful patient history is therefore essential, with particular attention to possible rodent exposure, occupational and environmental risks, travel history, and contact with known cases in areas where hantaviruses are present. Laboratory confirmation relies on serological testing to detect hantavirus-specific IgM antibodies or rising IgG titers, as well as molecular methods such as reverse transcription polymerase chain reaction during the acute phase of illness when viral RNA may be detectable in blood. Samples collected from patients are a biohazard risk. Laboratory testing on non-inactive samples should be conducted under maximum biological containment conditions. All non-inactive biological specimens should be packaged using the triple packaging system when transported nationally and internationally. Treatment. There is no licensed-specific antiviral treatment or vaccine for hantavirus infection. Care is supportive and focuses on close clinical monitoring and management of respiratory, cardiac, and kidney complications. Early access to intensive care, when clinically indicated, improves outcomes, particularly for patients with hantavirus cardiopulmonary syndrome. Prevention and control. Preventing hantavirus infection depends primarily on reducing contacts between people and rodents. Effective measures include keeping home and workspaces clean, sealing openings that allow rodents to enter buildings, storing food securely, using safe cleaning practices in areas contaminated by rodents. Avoid dry sweeping or vacuuming rodent droppings. Dampening of containment areas before cleaning. Strengthening hand hygiene practices. During outbreaks or when cases are suspected, early identification and isolation of cases, monitoring of close contacts, and application of standard infection prevention measures are important to limit further spread. How is Andes virus compared to COVID-19? We will find out in these next two clips.
Let's bring in Thorsten Feld. He's a consultant doctor in infectious disease at the University Clinic in Düsseldorf here in Germany. He was one of the first physicians in the country to treat COVID patients back in 2020. Pleasure having you on the show today. Exactly, within those recommendations, but every country involved, you're talking about local authorities, they're kind of doing it their own way. Do you understand public concern about this? The memory of COVID is still very fresh. We remember the pictures of back in the day. Everyone says this is not the same, but the fact that it does very much seem like we're not entirely sure how this is spreading from one person to another, and it does kind of give the sense that there is no full control of the situation, at least.
You really cannot compare it to the COVID situation. As you say, when we faced the first COVID patients, we did not know the virus, we did not know how it spreads, we did not know how to protect ourselves, what the risk factors are. And here the situation is totally different. We know the virus, it's a rare virus, but still we know it. We know how it is transferred from human to human, how the infection mode is. We really have a good information on the protection measures because we know how it spreads, and so we are ahead of the curve, as we also know the source of it, because all those patients, those persons are traceable down to the cruise ship, and this is why we can do effective contact tracing and can also isolate and quarantine the contact persons and the infected ones.
We're also going to be speaking in a moment to consultant virologist at Adam Brooks Hospital and host of the Naked Scientist podcast, Dr. Chris Smith. People have been asking if this virus could be the start of another pandemic like we saw with COVID. But on Thursday, the World Health Organization issued this reassurance.
This is not coronavirus. This is a very different virus. We know this virus. Hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those out there who are asking these types of questions. But this is not the same situation we were in 6 years ago.
The World Health Organization speaking on Thursday. Let's bring in Dr. Chris Smith. Chris, good to have you with us. How is this virus different from COVID?
It's a completely different family of viruses, and although they both spread and they cause serious disease under certain circumstances, they have totally different reservoirs. In other words, this virus is an animal virus, it's never a human virus. COVID-19 is now a human virus, and it spreads very well between humans but doesn't make us very unwell anymore. This virus is quite different, it's quite distinct, and has a quite unique geography to it in this particular form, and that's why it has a higher mortality rate, but also is easier to control because it doesn't spread very well between humans, and we also know what the likely risk factors are that will lead to a person picking it up.
COVID mutated, and we got used to hearing about all the different variants that were emerging. It was pretty transmissible at times, wasn't it? So what's to stop that happening with hantavirus?
Because this is naturally an infection of, as Hugh was saying, rodents, chiefly mice in some cases, rats in other cases, this particular subvariant is probably carried by a rat. This is not well adapted to humans, and that's why when it does very infrequently jump the species barrier and get into people, and the efficiency with which it does that we think is single numbers of percent, if at all, then it being very ill adapted to us tends to make us very unwell, but doesn't make us very infectious. It also changes or mutates only very slowly. So the likelihood of this evolving into something from this cruise ship outbreak into something that can spread efficiently between humans is really low. Now, the best evidence that that's the case is that we've documented this particular family of viruses over many decades, and there have been many outbreaks, including ongoing outbreaks in South America, and people do periodically get this, but they don't turn it into a form that then runs away like a mine train and starts to spread out of control. So we don't think that that's a very likely outcome in this circumstance.
The UK Health Security Agency is tracking people who may have come into contact with those on board the MV Hondius. How does that tracking work? We all remember the track and trace from the pandemic.
The normal way to manage a situation like this is that we regard the people who have been exposed as at risk, but not yet a risk, because until they're symptomatic, they're probably not infectious. And I say probably because obviously we do have limited experience with this particular virus, and every case is an exception. You never say never in medicine. But a really good rule of thumb with any kind of infection like this is usually people are infectious when they're symptomatic. So the best management is to give people all the information, ask them to self-isolate for a period of time that coincides with the incubation period for this. We know what that is with these viruses. It can be quite long, as Hugh was saying. It can be up to 8 weeks in certain circumstances. So the UKHSA have settled on 45 days at the moment as the time to monitor. People during that time will be asked to look out for certain symptoms and report those. They'll also be monitoring their temperature, and if they do have anything untoward, having reported that, they'll be tested and followed up. Samples will be processed looking for evidence of the virus. We're actually using PCR tests like we did for COVID. We'll look for the genetic material of the virus, and if we find it, we can then escalate the isolation in appropriate facilities. We've got 8 different facilities around the country which can handle high consequence infectious diseases like this one, and those people can then be properly isolated and offered not just therefore safe isolation, but also escalation of any medical care if that's needed.
Dr. Chris Smith, consultant virologist at Addenbrooke's Hospital, thank you very much.
What measures are being taken for the passengers that were on the cruise ship? We will find out in the next 2 clips.
We're seeing people in hazmat suits. Some of the patients who were infected on the ship, they are being treated in biocontainment units that are designed for Ebola. There's 42 recommended days of quarantine. You say we're being very cautious here. All of what we're seeing, is that because the virus is especially dangerous or because doctors still don't fully understand this outbreak?
No, it's being cautious. It's being really considering the lethality, and it's also reflecting that the recommendations are really also defining those measures, and this is what we are following. Basically, the reason why the patients and contact persons are handled in high-level isolation units, which are prepared for the highest level for Ebola, for Lassa viruses, is also that the networks are established, the infrastructure, the rooms, the premises are prepared for that, but also the teams are trained in using various kinds of personal protective equipment. This is what we are also doing, what we trained and what is practiced.
But then in other countries, we're seeing different approaches, people just being sent home to quarantine there. What determines which response is appropriate here?
Well, this is often the decision of local health authorities, so they can really make different decisions. In general, if a patient is a contact patient and does not have any symptoms, and medical care and like treatment is close and really assured on a timely basis in case symptoms occur, there is nothing arguing against the home quarantine. But there is also different risk constellations, and you need to be ready prepared to treat patients and to offer supportive treatment, ICU treatment, in case symptoms occur and patients are deteriorating. So there's a lot of variables, but there's also a lot of like different strategies to approach the situation within those recommendations.
There's a university in United Kingdom, the University of Bath. They have promising work on a vaccine for the Hantavirus. Their post goes, a highly promising vaccine for Hantavirus is being developed by researchers from the University of Bath. The team is led by Professor S.L. Sartbeva, chemistry researcher at the university and co-founder of university spin-out company Ensilitech. This completely new vaccine has been tested in both the laboratory and animal models and has yielded excellent immune responses. While more work needs to be done to bring this vaccine to public clinical trials and approvals, this is a very promising development of a completely new and needed vaccine. The vaccine is being developed using both mRNA technology and ensilication, a revolutionary patented technology developed by Professor Sartbeva's lab at the university. This technology stabilizes vaccines and other biological materials by wrapping the active ingredients, proteins, in protective silica cage, which allows them to remain stable at ambient temperatures without the need for refrigeration. Professor Sartbeva has long been at the forefront of the field of vaccine development and is recognized for her contribution to the fight against COVID-19. Her work on thermal stabilization of vaccines and her vaccine advocacy work. Whenever a family member of yours ends up getting a disease, for instance, Hantavirus, and they become terminally ill, just know that God is being glorified by what they're going through. It is said in John chapter 9, verse 1 through 3, as he passed by, he saw a blind man from birth. As he passed by, he saw a man blind from birth, and his disciples asked him, saying, Rabbi, who sinned, this man or his parents, that he would be born blind? Jesus answered, neither this man nor his parents sinned, but this was so that the works of God might be manifested in him. And do know that in Romans chapter 5, verses 3 through 5, we are to boast in our afflictions, because affliction brings about perseverance, and perseverance proven character, and proven character hope. And hope does not put to shame, but the love of God has been poured out within our hearts through the Holy Spirit who was given to us. That is all I have for Hantavirus, specifically the Andes strand. I hope you all know now some knowledge concerning the Hantavirus. I hope whatever methods of preventing the spreading that you have learned is taught by those around you that do not know how to prevent the spread. Now, of course, it is hard to spread, but it's still good to know these things, just in case you haven't. And with that, I will now close this report. Thank you all for watching, and I hope Jesus blesses you, your friends, and family. See ya.